one of the things I miss while teaching, and it's
So, welcome everybody to the February 25th IU's Center for Applied Cybersecurity Research Speaker Series. I'm Joe Tomain. I'm a senior lecturer at the CACR and a lecturer in law at the Maurer School of Law here at Indiana University, Bloomington. We're very thankful today to have Dr. Susan Landau from the Fletcher School at Tufts University join us today. And this specific talk is co-sponsored with our great colleagues at the IU Hamilton Luger School of Global and International Studies and the Luddy School of Informatics, Computing, and Engineering, who has just started a great undergrad major in cybersecurity policy. And with that, I'd like to turn it over to Isak Enti-Usare, who is the Associate Director of Cybersecurity and Global Policy at the Hamilton Luger School, to introduce our great speaker today. Isak, please.
Thank you so much. And it is my sincere pleasure to welcome Professor Landau, who is a bridge professor in cybersecurity and policy at the Fletcher School and School of Engineering, as well as the Department of Computer Science at Tufts University. She's also a visiting professor at the Department of Computer Science at University College London. Susan works at the intersection of cybersecurity, national security, law, and policy. Her new book, People Count, Contact Tracing, Apps and Public Help, will be published very soon here in April 2021. She's also written Listening in Cybersecurity and Insecure Age, which came about because of her congressional testimony in the Apple FBI cases, and a myriad of other high-profile publications. Professor Landau has frequently briefed US and European policymakers on encryption, surveillance, and cybersecurity issues. She's been a senior staff privacy analyst at Google, a distinguished engineer at Sun Microsystems, and a faculty member at Worcester Polytechnic Institute, the University of Massachusetts Amherst, and Wesleyan University. She is a member of the Cybersecurity Hall of Fame, the American Association for the Advancement of Science, and of the Association for Computing Machinery, as well as having been a Guggenheim and Radcliffe Fellow. Please welcome me, join me in welcoming Professor Landau to this talk today. Thank you so much for being with us, Susan.
thank you, and I'm very pleased to. Am I being heard? Because I'm not showing up on the screen. Okay. Yeah. So thank you very much for having me. I grew up in New York, and so there are two things about my talks that come from growing up in New York. One is I talk quickly, which I'll try not to do, but the other is that I'm used to being interrupted. So if you have questions during the talk, put them in the chat and somebody will read them out to me when they think it's appropriate. So please feel free to do that. And with that, I'm going to do the boring Zoom thing of share screen with you guys. So here we go. So what I'm going to talk about today is, I get to see all the admits. So do you as this goes on. What I'm going to talk about today is essentially following the new book that I've written that will be out in a few weeks about contact tracing apps and public health. And what I've got here, of course, is a photo of what was happening in Wuhan just about a year ago as people were leaving the city, which, of course, if we knew then what we know now would not have been the right way to handle things. As Dr. Fauci said, months later, everything happened incredibly quickly. The first notice was at the end of December 2019. In fact, China knew about the disease weeks earlier. The doctors within Wuhan did, and it would have been great if they had reported it, but they were not. The first public notice was at the very end of December. It hit China in January, the rest of the world in February, March, April, and early June. And I don't have to tell you the impact of that. In New York County, numbers looked like this. I don't know how many of you spent time listening to Andrew Cuomo give his daily briefings, but across the Northeast, because the disease in the United States largely came from Europe, that is, it came from China to Europe and from Europe to the United States, the Northeast cities were particularly hit, those were the numbers. What we learned, although it took a bit of time, is that it spreads person to person. It's a respiratory transmission, and proximity matters. And Fauci, as well as others, but Fauci in particular, observed that you couldn't have a worse disease in terms of that. Because the other aspects of COVID are that it spreads before symptoms show. And that makes it particularly hard to control. We didn't know back in the early days of the disease if they were super spreading. Well, we knew there were super spreading incidents, but we didn't know what caused them. And that's one of the problems that enabled the disease to spread. The way the disease spread, sorry, one of the things about Zoom is I keep having to move you guys so you can see. One of the things about the disease spread is that it started in China, but it very quickly went to Korea and Singapore and other places in Asia. And Korea and Singapore were doing an exemplary job of controlling the disease. What they were using was computer devices. Namely, if we know the disease spreads from person to person and respiratorily, we want to know when people are close to one another. And there are various ways we can do that. Cell phones, of course, carry lots of data and transmit lots of data that could be used. The waves on cell phones, the various communication methods of cell phones would enable being able to determine if people are close to one another. At least that was the thinking. There's, of course, Wi-Fi, the way that you get data on your phone. There's Bluetooth signals as well. And both of those were being viewed as possible methods of determining when people were close to one another. In addition, determining whether two people were using the same IP address was another possibility, because if they're using the same IP address, they may be close to one another. And so that was the thinking. And in fact, that was what was used in Singapore and in Korea. So Singapore very quickly got up something called Trace Together, and Trace Together works via Bluetooth signal. So your Bluetooth signal, for those of you who are not techies, those of you who are techies, you know everything I'm about to say, or at least this little piece of what I'm about to say. Bluetooth signal is a nearby radio wave signal that deteriorates quickly after short distance, useful for checking proximity. It's the signal that your wireless mouse uses to communicate with your desktop. It's the signal your phone uses to support your laptop when you're doing a secure connection and your laptop connects to the phone network in order to download data. So Singapore used the Bluetooth signal to create an app called Trace Together. And the way Trace Together worked is that if two people were running the app, Allison and Bob, if they were both running the app and they were in close proximity to each other, say within 6 feet, which is the distance that is being used for transmission. In fact, outside, the distance has to be much closer in order to be there to be any danger of transmission. It's inside that 6 feet is the distance used. We'll talk more about 6 feet in a while. What Singapore used was 6 feet distance for 15 minutes. Since then, we've refined things more. But at the time when Trace Together was first launched in February or March last year, 15 minutes at 6 foot distance was believed to be the distance at which you were in danger of having been exposed to COVID. So if Allison and Bob are both running the app and they're within 15 feet of 6 feet of each other for 15 minutes, the apps exchange identifiers. Allison's phone gets an identifier from Bob's device, and Bob's phone gets an identifier from Allison's device. If Bob later, a day later, 2 days later, 3 days later, tests positive for COVID, the Singapore Health Ministry uploads all the identifiers that Bob's phone collected. Now, when Allison's phone downloaded Trace Together, she gave her phone number along with getting the app. And the identifiers on Bob's phone, the identifiers that Allison's phone released, are based on her phone number. So when the Singapore Health Ministry gets the identifiers from Bob's phone, it's able to immediately determine that Allison was within proximity of Bob. And then Allison is called by a Singapore contact tracer who tells her she's been exposed and she needs to quarantine. I assume everybody's with me on that one. What that means is that we've got a centralized system, centralized because the Singapore Health Ministry learns about Allison's proximity to Bob. Korea took a somewhat different approach. Now, Korea was remarkably well set up this is South Korea, remarkably well set up to handle COVID. And the reason for this is earlier in the decade, in 2013 or 2015, I can't remember now, MERS spread across South Korea. MERS, the Middle East respiratory disease, has a very high fatality rate. It's something that is transmitted to humans via camels. You might think about Korea and say, hey, there are no camels in Korea. How did this happen? In fact, what happened is a businessman who had traveled in the Mideast came back to Korea, came home, and felt ill. And when he went to the hospital, he did not tell them that he had been in the Mideast. He, in fact, went doctor shopping and went to 4 different hospitals over a space of days. He infected somewhere on the order of 28 or 29 different people in the 4 different hospitals. They went on to infect another 100 and some. All of the cases stem from this one person. And so South Korea learned a tremendous amount. It learned when you have a highly infectious person, you don't put them in a room with lots of other people. And if you look now at the South Korea solution for testing, the testing happens outside the hospital in fact, enclosed spaces where the tester is outside the space and the testee is inside essentially a plastic bubble. But South Korea also did 2 other things. South Korea amended its Privacy Act. So in the event of a health emergency, similar to MERS, in the event of a health emergency, certain kinds of privacy protections could be lifted, and the government could quickly get CCTV data, cell site data, and credit card information. And what Korea did, and the other thing Korea did is it changed its laws regulating health products, and it allowed, in the case of a health emergency, fast approval of devices. That was really important. So the United States and Korea experienced their first case of COVID on the same day. South Korea had tests out much faster than the United States. Now, part of that was that the CDC tests, the original set of CDC tests were contaminated. But the rest of it was that Korea had put in place a regimen for fast approval of tests that in the case of a healthcare emergency. What Korea did on contact tracing was not fully contact tracing, it was a mix of things. When somebody tested positive for COVID, South Korea immediately, the health ministry got the data of where they had traveled. Now, part of that was, of course, simply interviewing the person and asking them where they had been. But if you think of yourselves in the pre-COVID days, where you might have stopped at the bank and then got into the coffee house and then stopped on the corner to talk to a friend and picked up some apples because you realized you wanted to make apple pancakes in the morning. But 2 days later, you might not remember the apple pancakes. It's not exactly a significant thing. So the combination of CCTV and cell site location helped the Koreans track the path of people who were later diagnosed with positive COVID cases.
Susan, just taking you up on your offer, there's a question from the chat about the identifier used in Singapore. And the question from the chat is, was the identifier in the Singapore app not actually the phone number, but some other identifier?
With some other identifier, and that provides a certain amount of privacy. So if Allison and Bob are in close proximity, maybe waiting at a bus stop, maybe at the movie theater, and don't know each other, Bob doesn't learn that it was Allison who was nearby. There's a certain amount of privacy involved there. Not fully, because of course it's not private to the government. To get back to Korea, so in the case of Korea, what happens is when somebody tests positive, the contact tracers in the Korean Ministry of Health interview the person. They also study both the credit card information and the CCTV. So if the person, for example, was getting money from a bank machine, but other people in the proximity of the ATM were wearing masks, and maybe the person was wearing masks because it is more prevalent in Asian countries pre-COVID to do so in the midst of the outbreak of a disease. If people in the proximity of the ATM were wearing masks, and of course the transaction of getting money from a machine is very fast, then the contact tracers don't call the people in the ATM. But if the person had been at a restaurant, where of course you're sitting for a while, sans mask, they got the credit card information of who else was in the restaurant at that time, and they called those people to tell them they'd been exposed. So you'll notice when I talk about South Korea, they're not using the exchange of identifiers the way Singapore had, and they're not using a contact tracing app. They are using information about the person and the person's travels. They also published, and you can see it over here on the slide, they also published the whereabouts of people who had been diagnosed, where they had traveled in the days while they were contagious. And this in Korean will say, stepped into this store at this time for this number of minutes. At that time, in February and March, we didn't know that COVID doesn't spread very well from surfaces. So there was tremendous worry at that time that, you know, somebody goes in, puts down their handbag to pay for puts down their wallet, pays for a cup of coffee, leaves the store. Maybe the next 10, you know, maybe for the next day that the counter is contaminated and somebody could get COVID. Now, if that person had sneezed and left a tissue full of virus on the table and somebody else put their hand there and then, you know, wipe, one can imagine all sorts of scenarios. But in fact, COVID doesn't spread very much through surfaces. That listing that you see there was much more extensive last spring than it is now. And that's because people were re-identified by the public, because the identifiers would also say middle-aged man, middle-aged woman, and they would track them, including to the housing complex. And it was easy to discover, oh, it was that couple who were infected. And then there was a lot of stigmatization. So what Korea has done, among other things, is once the place has been cleaned, the coffee house has been cleaned, the fruit grocer has been cleaned, that information disappears from the website. That wasn't true originally. The other thing about that website is that it caused businesses to lose business quite quickly. So coffee houses that had an exposure, nobody would be in the next day or two, even though it had been cleaned. I should have shown you this slide earlier. This is the slide showing you what happened with MERS and how a single person caused all those infections. So there was tremendous interest in using phones for location tracking and also proximity checking. But of course, both of those have great privacy implications. If you know where somebody's been, that they stop at the church, they spend an hour at church every Thursday evening from 6 to 7, and maybe Saturday morning from 10 to 11. That's not when church services are, but it is when Alcoholics Anonymous meets. Or that they go to the maternity shop a whole bunch of times, and then they go to the hospital, and then they don't go to the maternity shop anymore, and they don't go to the shop to buy stuff for the baby. You know that maybe they've had a miscarriage. You can figure out information about somebody simply by knowing where they've been. They come home from work every day at 5 o'clock, but one Friday they stop at the bar for 2 hours, and then they don't come home from work at 5 o'clock anymore because they're not going to work. You know, when they lost their job. Proximity checking is, of course, also very revealing. It can reveal who a journalist's sources are. It can reveal somebody out on probation is staying with his aunt in public housing, when people in public housing are not supposed to keep anybody in their apartment who has been in jail before, is on probation, and so on and so forth. You can find out all sorts of things. So computer scientists, in particular cryptographers, but also epidemiologists, wanted to look at the issue of, could we design an app to determine proximity checking that does not reveal to the government or to anybody who was close to whom, doesn't even let Allison or Bob know if they don't know each other. If they do know each other, game's over, but doesn't let anybody know who has been next to whom. And there were 3 different groups, oddly enough, 2 of them, one from the East Coast of the United States, one from the West Coast of the United States, came up with the name PAC, privacy and something contact tracing. The 2 from the East Coast and the 3rd group was from Europe. But when I say that, in fact, one of the groups in the United States had people from Australia. These were really international efforts. All 3 of them were looking at the idea of decentralized apps. The information should lie on the phones themselves and never be shared elsewhere. That is, the data of who was next to whom. So they came up with this idea. They all went public within a day of each other, and they all had remarkably similar architectures. At the same time that they were doing this, Google and Apple were thinking about the infrastructure that was needed to support it. So while Bluetooth is on your iPhone and your Android phone, Bluetooth uses energy. It's actually fairly energy intensive. And so if you're going to use Bluetooth to check proximity, you have to control how the protocol works. And that Google and Apple were really nervous about proximity checking apps. The last thing that either company wanted was for their devices to be used as a surveillance system, and to build a surveillance system on top of their devices that governments and others could use in other ways. The fact that the Bluetooth signal is energy intensive gave Google and Apple a way to control how their system would be used. Namely, they figured out a way to make it less energy consumptive, but they would limit who would have access to this new way. So they wanted a system that would not allow location tracking and would not allow identity sharing. And that was fundamental to what Google and Apple wanted to do. So we have 2 different sets of groups. We have Google and Apple dealing with the hardware and the Bluetooth signal. And then we have these 3 groups, the 2 packed groups and D3, I can never remember, DP3T, working on the actual crypto algorithm. And they were talking to each other a lot. And what they realized fairly quickly is that Wi-Fi signals, I mean, very early on, the cryptographers, the epidemiologists, everybody realized that while everybody says, hey, you can track location via Wi-Fi, that's not particularly useful. Why not? Because Wi-Fi signal works outside. It doesn't work inside. Where do people get exposed and in danger? Inside. Forget the Wi-Fi signal. Gives you a general picture. It doesn't give you a specific picture. The IP address is not terribly useful either. Even if I'm standing in my study right now, if I were standing in one corner and somebody was standing in the other corner of my study, so as far away from me as possible, if we were here for 4 hours, maybe we would infect, one of us would infect the other. But if we're here for 15 or 20 minutes, we're far enough away in general. And keep in mind that statement in general. It's really the Bluetooth signal that is at issue. And the way that the apps, excuse me, work, or that is the way that Google and Apple have put together their system, is the following. Alice and Bob don't know each other, sitting on a park bench outside. They're having a 10-minute conversation. Then Bob is positively diagnosed for COVID a few days later. So he has the app on his phone, and as it happens, so does Alice. And they've exchanged those identifiers. These identifiers are different than the ones that Singapore used, because the identifiers are generated on the phone. They're not generated via the healthcare agency. So they're generated on the phone that is downloaded, on the app that is downloaded from the healthcare agency. But the healthcare agency doesn't know what the identifiers will be. Bob has Alice's identifier, Alice has Bob's identifier. Bob checks in. He is told his test is positive. He's sick. His phone uploads his identifiers to a public health server, not Alice's identifiers, his identifiers. All the identifiers he has shared over the time when he was infectious. Now, I've lied a little. He actually sends a generating key for those cryptographers in the audience, so to save bandwidth. For the rest of you, just assume that what I said is absolutely correct. That is, he sends his identifiers up to the healthcare server. Alice's phone checks in, depending on the app she's using, once a day, twice a day, 3 times a day, certain number of times a day, but not too many, so as to prevent Alice from learning exactly when she was exposed and therefore who might have exposed her. Privacy is important here. Alice's phone checks in, and at some point she gets an identifier on her phone that matches an identifier she's collected, and she learns she's been exposed. And she then knows she needs to quarantine. Everybody with me on the technology? Cool. So with this technology, Alice and Bob have both exchanged identifiers, but Bob doesn't know that whether Alice is ill. Alice doesn't know that it's Bob who exposed her. And the public health server only learns, the public health server that gets Bob's identifiers, well, public health already knew that Bob was positive because he'd been tested and that was reported to public health. So public health doesn't learn that Alice and Bob were in close proximity. It's a privacy preserving system. It also preserves the information. It also protects them about location tracking, because any app that uses this system, let me phrase this a different way. No app that uses this system is allowed to collect location. So there's no location tracking with this app, and there's no proximity sharing. So it solves a problem. But the question is, does it solve the right problem? And so I want to talk to you now about contact tracing. And what I have here is a photo of vaccinating for smallpox a long time ago. Smallpox was eliminated in the Americas and in Europe by the late 1940s. Eliminating it in the rest of the world was a complicated thing because there were far too many people to vaccinate. What public health did is test, trace, and isolate. Test somebody if you suspect they've got smallpox, trace whom they've been around, and then isolate all those people. And once you have, in fact, a smallpox vaccine, you can also give the smallpox vaccine to anybody who's been exposed. Smallpox vaccine works after exposure to smallpox. Works remarkably effectively till quite late. Contact tracing is also what's done for HIV. In HIV spreads through the exchange of bodily fluids, sex, shared needles. One of the studies on HIV discovered you combine the two groups of people who are engaging in lots of sex and are also doing drugs, and you really increase the risk of spread. What you need to do there is find who are the central people in the group. This is doing social network analysis. And the docs have been doing social network analysis. The contact tracers have been doing social network analysis for a lot longer than Facebook and Twitter. And they discovered, for example, how spread happens. Typhoid spreads through someone infected preparing water, that is handling water that somebody else drinks, or preparing foods. Ebola spreads through bodily fluids, including after the person is dead, which made it particularly hard to deal with containing the spread of Ebola in parts of Africa, where handling the dead, kissing the dead is part of funeral rites, is really important. In each one of these, the word isolate means a different thing. Isolate in the case of smallpox means keep the infected person away from everybody else. In the case of HIV/AIDS, doesn't mean keep them away from everybody else. It means safe sex, no exchange of needles. In typhoid, it doesn't mean safe sex and no exchange of needles. It means don't let this person prepare food. In Ebola, it means no touching, handling anything from the person or anything from the person that might have any bodily fluids. Here are some contact tracers, some from long ago and some from in fact, the current situation. And when in the process of writing this book, I talked to a number of contact tracers, and what they all said was the most important thing when you're doing contact tracing is establishing trust. You call the person who has been diagnosed. You first ask them about themselves. You ask them how you can help them. One of the contact tracers I talked to described talking with a woman who had had a positive, who had been exposed to HIV, and she needed to go for her test. And this was in the Midwest, and her OBGYN was not willing to set up a test for her. So the contact tracer drove 35 miles, picked her up, took her to a testing site, drove her home. He did 100 and some miles that day, but got her tested. Other contact tracers were drawing blood, getting the blood tested, coming back to the prostitutes in that case who'd been exposed. It means in Liberia, when I talked to Liberian contact tracers about what they did during the time of Ebola, they were working for Partners in Health. And what Partners in Health did was, as people were told to isolate after someone in their family who had Ebola and had been removed from the house, Partners in Health provided money so that neighbors could bring food to the home. Isolate means different things, but in all of this, what is going on is the contact tracers first establish trust with the people who have been exposed, who are ill. Then they have to establish trust with the people who have been exposed so that the people who've been exposed will follow the recommendations of isolation. So back to digital contact tracing. After the contact tracers, after the Google and Apple announced their partnership, at first there were government efforts in the UK, in France, in other places to develop centralized apps. But Europe has pretty strong privacy regulation. And very quickly, the EU passed a policy that there would not be centralized contact tracing required by the government. And so Switzerland was the first one to launch its app. One of the interesting things about the Swiss app is that it says that if you have been sufficiently exposed that you are that you're told to isolate, to quarantine, then the Swiss government, and you can't work from home, then the Swiss government will pay your salary or pay a stipend during the time that you have to isolate. Covert Tracker was the Irish app. It had an interesting characteristic. When you downloaded the app, you were asked whether you wanted to provide your phone number. If you did so, if you were exposed, then you would get a call from the contact tracer as well as getting an exposure notification on your phone. So in most cases, when you get an exposure notification, you're on your own. Your phone says, you've been exposed, isolate. Hey, do you want to call public health for more information? But in the case of the Irish app, if you provided your phone, you get a person calling you and say, you've been exposed, let me talk to you. How can we help you? And so on. Virginia was the first state to launch a COVID app. That didn't happen until August. The US states were slower. One of the things that goes on in the US is, although we hear a lot about the CDC, in fact, public health is a responsibility of the states, not of the federal government. At the point at which Virginia launched its app, Google and Apple decided that they would try to make it easier for the states to launch apps. And they created something called EN Express, Exposure Notification Express. And what that does is essentially creates a little table for the states. What languages do you want it in? What's the distance that you think an exposure happens? How long should people be close to one another before an exposure? One of the things it doesn't do, however, is say, can the person upload their phone number to the state health department? So it doesn't allow the type of solution that Covert Tracker has. One of the things that was interesting to me is when I was talking with Google about this, the policy person knew that the change in EN Express. The technical people had not even realized the capability lying within Covert Tracker. So now let me go back to the question of whether the contact tracing apps solve the right problem. And first of all, the first question is, does it really solve the problem? So prior to the launch of the Swiss app, engineers tested if the app can really measure distance appropriately. And they set up a mock train, and they had Swiss Army sit on the train and talk and use their laptops and so on and so forth, and checked whether the data registered. And the answer is a train, their train is not the same as this type of train. So Dublin researchers took phones onto the Dublin tram cars, the light rail, and tried the phones with the apps. And what they discovered is the app signal would decrease as people got further apart, and then at some point it would increase a little. Why? If you look at the tram car, you'll understand exactly why. There's glass windows in this piece, and then there's two tram cars joined together. They're not joined together by glass windows through which the signal goes. They're joined together by metal where it reflects in various ways and can strengthen the signal. Well, it's not just tram cars that will do that. The effort done by the Swiss Army also included a mock cocktail party, a mock restaurant, but they were doing it in that big gymnasium where the signal goes all away. And so one thing is that the measurements are hard to do. For example, so one of the things that set me on doing this actually is one day I was sitting at my desk working, and my cursor started going all over the screen. Now that happened in Ukraine when there was a hack against the power grid of 3 different distribution companies. And I thought, wait a minute. And then I thought, I'm not important enough to be hacked in this fancy way. And I shouted upstairs to my husband, whose study is probably 25 feet from mine. It's at the opposite end of the house and a floor up through plaster walls. We have an old house. I said, are you using your mouse? And he said, yeah, and I can't get it to connect at all. I said, it is connecting on my machine. That's 25 feet away. Okay. So it turns out that the Bluetooth signal does not go very well through cement walls, which is good for people who live in public housing, but it goes through wood walls. And so if people are living, for example, in the type of housing that I have near Tufts, then people in 2 separate apartments who might never see each other, might never be within 20 feet of each other, will still register positively in the same way that my husband and I might do if we were locked in our separate studies all day and never seeing one another. The question of solving the right problem is dependent on how COVID spreads. And for that, we need to think about the way different societies live. So there was a study over the summer that looked at Chelsea, Massachusetts, where there was extremely high spread very early. People doing random testing on the street found something like 1 in 4 or 1 in 3 Chelsea inhabitants had been exposed, had COVID antibodies, if I'm remembering correctly now. Well, why in April did this city near Boston have 6 times the average for the state? A whole bunch of reasons. Heavily immigrant population. It was Latinx from Central America. So there were all sorts of things. One is that people lived in crowded conditions and multi-generational. 2 is that a high percentage were involved in food service industries where there's lots of contact with other people. And the third thing was, going back to the immigrant population, many of them came and were non-citizens without appropriate documentation. And so when somebody was ill, they didn't want to go to the doctor, because even if they were legal within the United States, maybe a relative, maybe a friend was not, and they didn't want to expose them to government surveillance. There was a fourth issue, which is that in February, the Trump administration, I'm going to forget the name of the change, but they put forth that anybody who used government dollars for healthcare, for welfare, and so on and so forth, might lose visa eligibility, citizenship eligibility, green card eligibility. And that also was a disincentive to go for public health care. That was rescinded during the pandemic, but not everybody trusted that it wouldn't be implemented again. So this population was highly infected in part because of government policy, that is government policy that made it hard for them to do certain things that would make them healthier, and in part because of where they were working. Different population, Black Americans, as most of you must know by now, have a distrust both of the government and of government public health. There was, of course, the Tuskegee experiment, in which men infected with second stage syphilis were not treated with penicillin, which could have cured them, but instead studied as they grew ill and more ill from the disease over a period of 40 years. There was redlining done by government housing policies, which ended up with Black Americans living in more crowded conditions, less healthy conditions, including areas that are more highly polluted. Black bodies have been used in various ways for experimentation and surgery in ways that they didn't necessarily permit. And the result, or weren't asked about, the result is that there's a greater distrust of healthcare and public health, of healthcare, vaccines, and also the government. When I spoke to some Black Americans about these issues, Black American people who work in public health and in sociology, what they said is, a Black American living in a middle-class neighborhood might feel perfectly fine about downloading an app. A Black American living in a neighborhood where he's been stopped by the police any number of times, going to stay away. Doesn't feel safe. Native Americans, on the other hand, interesting story that comes from the White River Reservation. There, people, like most of Native Americans living on tribal lands, are less healthy, high rate of diabetes, various other illnesses. And the public health community was very concerned about this potential for spread. Families they're poor, they live far from healthcare in general, the roads are poor, and they live in multi-generational situations, so easy spread from young people to old people. What the public health group decided to do is, when they go to visit families and they discover that there is somebody ill, they right away test everybody in the family. And in particular, they make sure that the person who's ill has an oximeter on their finger, and they watch them when they walk, because one of the peculiarities of COVID is that somebody can feel perfectly fine and then collapse. It's called happy hypoxia, low oxygen levels that they don't notice because of the peculiarities of the disease. And with the distance to healthcare, getting somebody, when they have this problem, getting someone to hospital quickly is really important. The other thing that the contact tracers did in here was that they started asking the family have the children been visiting the other grandparents? Because it's quite common in the Navajo culture for children to spend a week, 2 weeks visiting other grandparents on a frequent basis. And what that means is the disease can easily transmit from one home to another home 20 miles away. So what they were doing here was taking into account the cultural differences. So how does it all sum up as we start thinking about contact tracing apps? Well, in February and March, we had centralized solutions. In April, the European Parliament said, no, what works in Europe is only a government, there can be centralized solutions that people opt in for, but the only thing governments can require is a decentralized one, or push is a decentralized one. And then in April, Google and Apple announced their collaboration. The apps were launched, uptake wasn't great, and it was hard to measure because, of course, there is no data that comes back about what somebody does once they've received an exposure notification. However, by looking statistically, it seems that the apps are helping some. I heard a talk recently about Swiss COVID app, and the numbers show where uptake occurs, there is some usage. There is some drop in the spread. But let me talk just a little bit more about things that go wrong before I go to things that go right. One of the things we discovered later is that the disease can spread far more than the 6 feet we'd been assuming. A restaurant in, I'm forgetting the city in China at the moment, but not Wuhan, they discovered the spread went 15 feet because of the way the airflow was. So that the contact tracing apps have false positives, as I described earlier, they also have false negatives. We also discovered super spreading events. And super spreading events, this one is the White House Rose Garden ceremony for Amy Coney Barrett. The super spreading events happen when people are close together, when there's an infectious person, and when airflow happens in ways that we don't fully know how to map yet. How does it all sum up? Well, we need to learn better how the coronavirus spreads, and we need to learn whether the apps are all that useful. We need to first protect user safety. An important point is that false positives don't protect user safety. So a low-income worker who gets an exposure notification on their phone that says quarantine for 10 days or 2 weeks. This is a person who can't afford to lose their paycheck and can't afford to lose their job, but they follow it the first time. Maybe they follow it the second time. They certainly don't follow it the third time. So a false positive for me is upsetting, but all it means is that my husband goes to the supermarket once a week instead of me, or that we get the food delivered. I'm working from home, it's easy. But false positives have a disproportionate effect on the lower income part of our world. The apps should always be a user's choice and there shouldn't be coercion. The app should only ever be used for determining coronavirus exposure. When I wrote that in the book 6 months ago, however long ago it was that I handed in my manuscript, that was a statement that I and lots of public policy groups had already enunciated. But since that time, it's come out that Singapore is using it also for law enforcement investigations. You're not going to find various groups using the apps if they discover that it's being used for law enforcement investigations. Or, for example, would anybody in Chelsea download the app or use the app and if it was used for ICE investigations? Fifth, the apps should be transparent. One should know, Fourth, and this is really critical, we need to evaluate prior to deployment and during deployment how the app is working in varied communities. So there's a study that came out from the UK. It's a statistical modeling study that says use of the app has cut back the spread of the disease in between 200,000 and 900,000 cases. That's very impressive. And they've done a good job of modeling as far as I can tell. I'm not a statistician, but I've read the paper through twice and I was once a mathematician. But what it also says is that the uptake of the app and the use of the app is more in rural more white communities. If we think about what the app might do, it can skew it. Anytime you cut off a transmission chain, you're helping everybody. And the decentralization of apps that the cryptographers did is extremely valuable. But we need to think of the apps, the use of the apps within the whole public health context. And if the app is helpful in certain communities, what are we doing in the other communities to help them too? I was really struck by this point recently as I spent a large part of last week, Thursday and Friday, on the website trying to get my husband and me vaccine appointments in the state of Massachusetts. So every 10 or 15 minutes, I'd hit 4 websites, and then I'd go back and I'd do it again. And I happened to be lucky that I could, open 4 windows and do that and waste my time in that way until I finally actually managed to do it. But the point that I'm making is we have been using limited healthcare resources in various ways. If we put the healthcare resources here, we're not putting them there. Finally, apps should be transparent. And so I want to sum up with 2 stories. And they're stories of different approaches to the apps. In Korea, they looked at their experience under MERS, and they decided that they were going to change their privacy law and the regulation of healthcare devices. And they were well prepared for when COVID hit. They violated privacy and they pulled back some. That is to say, they published less about people who have been ill and traveled around the city prior to diagnosis. But they've opted for one set of information. It's a lot of public information that I think the US would not do. Harvard decided to try to use IP location. If they knew 2 people were in the same room because their devices were using Harvard's IP network, then if one of them tested positive for COVID, they could inform the other one. And they put in technology to do this in a few buildings on campus, and they ran an experiment for several months last summer into the early fall. Now, Harvard has very strict privacy rules about how IT uses the data it collects. This is partially a result of something they didn't handle well in a different way than South Korea a few years ago. At the end of the period, they decided that it wasn't turning up enough useful information to either be worth the financial cost or the potential invasion for privacy, and they dropped the experiment. But in both cases, the country and the university, they thought hard about what was important to them before they changed their rule, before they launched their efforts. They thought hard about the balance between public health and surveillance. And that's about all I want to say. There was a 1993 National Academy study on AIDS, on the social impact of AIDS. And the report observed that an epidemic is both a medical and a social occurrence. And the question is, what kinds of medical and social interventions do we want to make? Because the choices we make now will reverberate forever. That is to say, this is not the last pandemic we'll face. Given the propensity of people to live close to wild animals, and we're doing that more and more, wild animals serve as a reservoir for new diseases. Given that propensity, we will face other pandemics. The choices and decisions we make, whether it's the deep thinking that Korea did or the deep thinking that Harvard did, we will live with those choices forever. So thank you. And I'm happy to take questions now.
Thank you, Susan. That was great. So for folks that have questions, if you'd like to either raise your virtual hand or post a question in chat, we'll get those questions to Dr. Landau. Apu, please go ahead.
Hi, thanks for the great talk. I really like the point that you made about the false positives having, a disproportionate impact on various communities. And I just feel like a technology such as Bluetooth is just going to result in a high enough false positive rate that these types of contact tracing apps shouldn't actually be viable in communities that do feel this impact. Is that your sense? I mean, I don't know if you were just hypothesizing or if you actually did notice this in your research.
So people who live in crowded housing are going to have more false positives. And then it depends what type of crowded housing. And that's why I mentioned cement block. Public housing in the United States and in the UK is largely relatively modern and is cement block. So that doesn't show up. But if you think about immigrant housing, for example, in parts of Queens, New York, those are old houses, they're wooden frame, and yes, they're gonna show up as false positives. I mean, there are two different ways to look at this. One is you cut off a transmission chain and you've saved a lot of people from getting infected. Had we cut off the transmission chain, I think there were 3 people at the Biogen meeting. I'd have to go back and look at the paper. Between 1 and 3 people who were ill at the Biogen meeting. They ended up infecting, I think, upwards of 200,000 people in the end. Cutting off one transmission chain can have a tremendous effect. But then you have to make sure your laws and policies and public health perform in an equitable fashion. So I don't think that the false positives are an argument against doing it. I think you have to make sure your public health compensates in other ways. And that's why I brought up the example of Swiss COVID and paying people to stay home.
And Joe Utagwa.
Hello, I really enjoyed the talk. I learned so much, but I want to ask, as a college student, some of the examples and the studies you mentioned were like new to me. I've never heard of them. And of course, you've been alive longer, but how, like, do you have any recommendations for like finding those kinds of historical examples? Like, where should I go to read or like watch?
Well, you could read my book and look at the bibliography in there. I mean, I think, how does one go and learn a new area? I mean, that's a hard question. You take a course, you look at reading lists from courses, because of course the people who prepare a course know their authoritative sources. You find, I can answer in a little bit how I did that, and that's not the answer for you, but I was first interested when I heard somebody say, I was on a ferry and it turned out that somebody on the ferry had COVID and now we're on the island and I want to know where he is. I want to track it, you know, and we all have our phones. Let's use the Wi-Fi to know where he is. And I thought, that's crazy. This guy is technologically capable, and yet he's arguing something that doesn't make sense given that COVID spreads inside. So I wrote a blog post. And then I began thinking a little, I blog for something that's read a lot in DC. And then I thought a little bit more and I realized what we really want to focus on is efficacy. And then I'd been in a community where there was some talk about equity and I worked with a couple of colleagues and we did a blog. And so it snowballed. But with each of those, I read more things and sometimes I reached out. So I'm not an epidemiologist, I'm not a medical professional, but I managed to go in to have conversations with people as I explained what I was doing. Now, as a college student, it's hard for you to do that. A public health professional, especially in this busy time, won't say that. But if you wanted to learn this particular area, then I'd say, go to the medical school, go to the public health school and see what courses there are. Maybe you can take a course, but also you can look at the syllabus and see what the authoritative sources are. Then you can go to the professor, you say, I've read this, I'm interested in learning more. Or I've read this, I'm interested in learning more, and I'd even be interested in working with you if you had a project for somebody with my expertise.
Great question, Joe. As we're running out of time here, before I turn it over to Isak to close us out, I just want to say first, thank you, Dr. Landau. That was a really wonderful presentation. I do use your efficacy piece from Lawfare in my privacy class. And I also want to say, lastly, before I turn it over to Isak, is that our next CACR Speaker Series is a month from today on March 25th. We have Meredith Harper, who is the Vice President and Chief Information Security Officer of Eli Lilly. Our co-host for that March 25th event with Meredith Harper is the Kelley School of Business. And so with that said, Isak, please close us out.
Well, I would be really wrong to try to add anything to what was a really interesting and thorough talk. So I will just end by saying thank you all for being here, and most especially, Susan, thank you for your time. This was provocative, really thought provocative in terms of the social determinants of the creation of technology and the actual use in different contexts. So I am so thankful for your time. Everybody, please join me in thanking Susan for her time. Thank you.
Thank you all. Hope to see you next month.